I want to welcome all of you to the annual meeting for Healthcare for All North Carolina. It's exciting to see all of you here, and we hope that you can enjoy the speakers that we have today. We're very grateful that Dr. Uma Tadapelli and Melinda St. Louis are here to speak with us today. And then we also really hope to offer a lot of space for all of you that have joined us to spend time together and learn from each other and share your ideas and desires for involvement in the Medicare for All movement and in the single payer movement. So we really appreciate your time here with us today. My name is Hannah Potter. I'm the president of Healthcare for All North Carolina. Healthcare for All North Carolina is a chapter of PNHP, which is Physicians for a National Health Program. And our organization is the Healthcare for All North Carolina, but we represent mostly the Triangle, Triad, and Eastern part of the state. There are two other PNHP chapters in North Carolina, one in Charlotte, Healthcare Justice, and then one out in Asheville, Healthcare for All, Western North Carolina. And our organization works towards achieving a single payer system that offers guaranteed universal quality healthcare for everyone in our country. So we really welcome all of you into our work in any way that is feasible for you. There's lots of different opportunities. You'll learn some more about the work we're currently doing, the work of some of our partners and collaborators. And we also want to hear from you about ideas for what and how you want to contribute to the movement. So again, welcome everyone. Please feel free to introduce yourselves in the chat, share your name, share where you're at, how you're feeling, what brought you here today. And we really hope that this can be a interactive space as we continue to build community around this movement. So I will pass it on to Will as he is going to do a special presentation for us to start us off.
Great. Thanks, Hannah. Well, I think we're real fortunate to have some nurses from Mission Hospital, as well as all the members and guests on the program today for the annual meeting. But one reason I know we have some of the nurses on is because we had a recent death of a really active healthcare activist, advocate, and a real advocate for all our coworkers in our community. So we're excited to announce the creation of an annual Maggie Nelson Courage and Justice Award. Maggie died just a couple weeks ago, and Maggie was a beloved coworker. She was a registered nurse at Copestone Mission Hospital up in Asheville, North Carolina. And she was also a political activist, and she was an instrumental leader in the historic Union victory in 2020 at Mission Hospital. And although Maggie was, she was petite in physical stature, she had mighty determination, and she was courageous, compassionate, and was a relentless advocate for her coworkers, community, and her patients. And as a frontline caregiver, she believed that all the healthcare system should be universal, and it should be centered on the needs of every person. And she saw firsthand as a healthcare worker the need for Medicare for all and a union. And she believed by joining together, all things are possible. So this award will be presented in the spirit of connecting us all in this common struggle for healthcare justice. And I know that some of the nurses here may want to say a few words about Maggie. I know we all have special things that we remember about Maggie, and she was a special person.
Thank you, Will.
Thank you, Will. I'm Kim Anderson, and I wanted to share I just wrote a little thing to share about Maggie that I wanted to read. My friends and I first want to thank you and the board. Thank Will and the board for this opportunity. I knew Maggie Nelson for 11 years, and we really grew close over the last 6 years. Maggie believed in fairness and justice. She believed in universal health care and Medicare for all, excuse me. She used to attend Moral Mondays with Reverend Barber. Some of you may know about that when that was going on, and she did that here in Asheville. Politics were important to her, and she followed them closely. One of her heroes was Ruth Bader Ginsburg. She would call senators and congressmen. She did. To go on record with subjects important to her, and she encouraged others to do the same. And that's when I started calling. Maggie attended the Women's March in Washington, D.C., the first march in 2017. She was a leader that worked hard to get support for the union at Mission and to ensure the historic votes passed. She was also involved in NNU union efforts as a nurse in California in the 90s. And this award carrying Maggie's name is an honor and most fitting legacy for her. And Maggie's friends and family, thank you guys. And it's still raw. She passed away April 11th. And I've been up all night working, so I'm pretty emotional.
Thanks so much, Kim.
I don't know if anybody else wants.
Yeah, well, I slept all night and I'm pretty emotional. Loved her very much.
Yeah, Maggie was well known to all of us. Everybody remembers her for her wit, and that's the first thing that drew me to her. I've known her 20 years. We worked on another floor together for 7 or 8 years, and we've been on Cookstone. I brought her to Cookstone 13 years ago, and she loved it. She wanted to retire, and then she couldn't. She just wouldn't do it. She's got too much to do. So Maggie will be in our hearts forever, and with this beautiful honor today, we thank you because it so fits her, and we thank you from the bottom of our hearts. Maggie was so special to us. She will be forever.
Absolutely. I never would have thought of becoming an activist without her. You know, I've always supported, more liberal leaning causes, but I've never actually gone out and decided to fight for them. And because of her, she put that fire inside of my gut to actually get out and pound the pavement for greater justice. And I'm forever in her debt for that.
I'm grateful to her. Thank you, Will, for having us.
Absolutely.
Oh,
You'll
yeah.
hear from us again.
Oh, I know we will.
Promise.
This crew they're really strong fighters, and their courage has been amazing through the union program. And I will say with Maggie, that's how really I think I came to know all of you all was it was through the union struggle, but also Maggie was the one who introduced. And every time, as you all know, I said, Maggie, we've got to get to this floor. We have somebody we haven't identified yet, and we need to do it. Maggie was there, and even in other parts of the hospital. And I know one time Maggie went to a unit where that's not where you all practice, and Maggie brought cookies to that union.
That's right.
Maggie was amazing and a great sense of humor, and she will be missed. But I'm glad we can do this. And one thing I didn't mention when I was just introducing the Maggie Nelson Courage and Justice Award is that we'll do it. It will be an annual award, and it will be done right before that Moral Monday thing that we've talked about before. You know, that grew out of the HCFANC march that I think at different points we've had tens of thousands, maybe 60,000 people down there in Raleigh, which some of the people on the call are probably familiar with. But there's a breakfast that takes place before that annual march, and that's when we'll present the award to a fitting, deserving health advocate activist. So
Thank you.
anyway,
Thank you.